vitamin D, a life-sustaining nutrient. Too much sun can cause skin cancer, which can be deadly.
Skin cancer is the most common form of cancer in the U.S. It accounts for more than 50% of all cancers combined. More than 1 million cases of non-melanoma skin cancer is diagnosed each year in the United States.
Joining us now from the WellSpring Oncology Cancer Center is Dr. Robert Miller. Hi, Doctor. Thanks for being here.
Thanks for lounging with us, guys.
Thanks for bringing the chairs.
Yeah.
A great idea.
You want to be comfortable?
Yeah. Serious topic, though.
Right. So May is skin cancer awareness, and we want to remind everybody of that. They joke that the sun is 93 million miles away, and we don't notice the warning sign that says, beware, ultraviolet rays can be bad for you. So we want to remind everybody of that.
Well, now, 11,590 people die in the U.S. each year due to skin cancer.
Right. The most serious are melanoma, of course. And fortunately for us, the most common cancers like basal cell and squamous are very treatable. The trick is to notice your own skin, be aware. Even living up in Canada or in Ohio, those burns in Michigan will pay bad dividends later.
Right. That worries me because I remember having a few sunburns that blistered, and I've really upped my chances of 1 in 3 Caucasians will get it, right?
And you need to identify yourself as even a higher risk person. So if you're freckled, fair skin, never got a good tan, if your family was English, Irish, Scottish, then your odds instead of 1 in 3 are probably almost guaranteed, 60%.
Gosh.
That would be my wife. She's already had at least a dozen procedures to have cancerous.
You keep ahead of it, she should be okay. The advice we encourage is, remember, UV radiation is bad, A or B. They used to think UVA was safe, and so tanning booths were thought to be safe. Now they know UVA, UVB, they're all bad. So don't go into a tanning booth, don't use the sunlight.
When it comes to the protection factor of a sunscreen, what do you recommend?
Well, the higher the better. The Cancer Society says an SPF of 15 is okay. The dermatology want a 30. Once you get up to 30, it blocks 97%.
Oh, really?
If you pay for the 50, SPF of 50, it blocks 98%. You get up to 100, it's 99%. So if you want to pay and get the good stuff, you know, an SPF of 100, it blocks 99%.
There's no such thing as a healthy tan, is there?
No. If you really feel you look better bronze, have somebody spray something on you.
You're okay with
Stay
that?
out of the sun.
Okay.
Now, some people think if I've got all that coverage on me, I'm not going to absorb the vitamin D that I need.
Yeah, the vitamin D shortage is uncommon, but if it really makes you nervous, you can take a multivitamin. It works just fine.
Okay, well, that's good to know. So, really, what would you suggest as far as children? Because, you know, babies really need to be protected. Their skin's probably more sensitive, I would assume, than
Right,
adults.
they say a 6-month-old, you shouldn't take them in the sun at all. And then when you have toddlers, the mothers will be very careful with helmets, seat belts, don't talk to strangers. But they often ignore the skin. So get them to wear a big floppy hat. If it's really in the sun, see if they would put an umbrella or a parasol over them. And then spray them every 2 hours with a good SPF skin block, at least a 30.
And they make good ones for kids that don't get into the eyes or sting
Yeah, you
like
can
some
do
of
the
them
sprays.
do.
Sometimes the sprays are more comfortable or convenient than the creams or the ointments. But just cover them up. Remember, repeat it every 2 hours.
All right, you can still enjoy the sun.
Yeah.
Just be careful about it. Dr. Robert Miller from the WellSpring Oncology Cancer Center, thank you so much. I'd like to do the rest of the show from here. What do you think?
That's not a bad idea. Well, coming up, another kind of serious issue. Face it, childhood obesity is a big problem, and it's kind of up to us to try to change that.
Yeah, we're in the kitchen, and we're looking at some healthy choices that your children will absolutely love.
Be right back.